but you are going to be administering potassium to your patients because if your patient has any type of nausea, vomiting, diarrhea, that means they're depleting their body of potassium. If your patient's on a diuretic, they're depleting their body of potassium, right? If your patient is anemic and they have some form of blood loss, they're depleting their body of potassium. So you're always supplementing potassium, okay? Your order in the computer is gonna read IV piggyback. So IV PB, okay? It's not IV piggyback. Reason being, so you guys just learned that basically you have a maintenance fluid bag, which is usually anywhere from 500 to 1,000 milliliter bag, right? Then you have your piggybacks, which are gonna be like smaller bags. So it can range from 50 to 250 ml bags, okay? Your potassium comes in, is it 100 ml or 50? It's 50, right?
50.
So your potassium comes in the small bags. So what happens is nurses see that order and they assume it's a piggyback order, meaning that I'm supposed to back prime it with like whatever my maintenance fluid is and then run it because this is gonna run and not my saline, right? What we just showed you guys with the antibiotic. With potassium, it's very caustic to the veins. And what that means is it can cause necrosis on your patient's veins, and it can also cause the veins just to like, if you have a perfectly good vein, it can cause it to go bad on you, like infiltrate very easily because it is so caustic, okay? How do we kill people when they're in prison, or how do you put down a dog? It's an IV push of potassium, okay? So we will never IV push potassium, okay? We will never bolus potassium into a person because we will kill them, okay? So when you guys are hanging potassium, the proper way and the safe way is you're still gonna have this little 50 ml bag of potassium, right? You're going to also have your maintenance fluid, whether it's a 500 ml or 1,000 ml bag. It has to be normal saline. It's not gonna be lactated ringers or anything else, okay? D5-half-NS is compatible with this, but just make sure you look up your compatibility. But for this, we're gonna say it's just 0.9 normal saline is my maintenance fluids, and then this is my potassium that I need to run. So they usually, they can come in 10 milliequivalents, 20 milliequivalents, or 40, and you're gonna have an order of whatever rate you're going to run it at, okay? Because it's so caustic to the veins, some physicians might order this with lidocaine, and then that would come from the pharmacy because they have to mix it with lidocaine so that it doesn't burn your patient's vein, okay?
Encourage your providers to get that lidocaine over, it helps.
Yeah. Okay, so you have primary tubing that's gonna go with your potassium, okay? No secondary tubing, primary. You also need another pump for your potassium to run on, and then you're gonna also have your maintenance fluids that have primary tubing and their own pump to run on, okay? So you're gonna put this in your pump, and let's say your maintenance fluids, like your order is for it to run at 100 milliliters an hour, okay? So I can keep my maintenance fluids running at that, and then usually your rate for potassium is gonna range anywhere from like 20 to 30 milliliters an hour. Sometimes it's as high as like 50.
The important thing to remember when running potassium is you cannot run it greater than 10 milliequivalents per hour. So whatever that happens to factor out to be.
Usually your order will tell you what you're supposed to run it at, okay? So just don't run it faster than that, because that's how you're gonna kill somebody, okay? So you have your normal saline. We're gonna say that I input it in the pump and I'm gonna have it run at 100 milliliters an hour. That is connected to my patient, okay? Then I'm going to spike and prime my potassium bag with primary tubing, and I'm gonna do the same exact thing on this side, okay? I'm gonna input it into the channel, and then let's say the doctor wants it to run at 30 milliliters an hour, okay? I'm gonna input that information into the pump. So the goal is to have your maintenance fluid running faster than your potassium because you want it to dilute that potassium so that it doesn't burn. And the reason why you're not doing it as a secondary is because we all learned earlier, whatever hangs higher is going to run. That we don't want straight potassium running into the vein. Your patient's gonna yell, scream, cry because it burns, it hurts them, okay? So just, if you can't get it with lidocaine because your doc's just not getting back to you or whatever, please just make sure that you have some type of maintenance fluids running with it so that it can dilute that for your patient, okay? So I'm gonna squeeze my chamber here. Find that. Hang it. Run out all the air bubbles. Okay, so I'm gonna input it into the chamber here, okay? Okay. This port that's up here, where you would normally hang or connect the secondary, that's where you want this tubing to connect. Okay, reason being, it's above the pump, and that gives it more time to dilute before it gets to your patient. Does that make sense to you guys?
Mm-hmm.
If I Y-side it down here, there's no dilution happening. That's maybe 3 mLs of dilution that will happen for your patient. Does that make sense?
Yeah.
Okay.
Now, here's the difference between the Alaris and the Bebron pumps. The Bebron primary tubing will have 3 Y-site ports. Well, yeah, it's got 3 Y-site ports. There's one that's like just after the pump, so that is ultimately the one you would want to use.
So for the Alaris, you want it before the pump, okay? It's still primary tubing, it's still loaded into its own channel, running at its own rate, just like your normal saline is its own channel and its own rate, and you're just connecting it at where you would normally do your piggyback, but it needs to be up here so that it gives it enough time to dilute before it gets to your patient. So this is running at 100 milliliters an hour, this is running at 30, okay? You never want the rates to be the same because you're not gonna be following doctor's orders. Or you don't never wanna change this to 30 and then this to 30, because then there's really no dilution happening. It's happening a little bit, but they're running at the same rate, so it's still gonna burn, okay? Any questions on how you set this up? Just always remember, potassium comes in a little bag, but it needs to be primary tubing on its own pump. Maintenance fluids, primary tubing, its own pump, okay?
And then they're gonna be hanging the same like that?
Same, yeah, cause this isn't secondary, I don't need any gravity or anything, it has its own pump. It has its own rate you're going to input in there. Okay? So if you guys see it, which you will, hanging as a secondary with that short tubing, please go and inform your clinical instructor so then they can hopefully go in and educate the nurse that is doing that. Because again, your order reads IV piggyback. It comes in a little bag. It's called a K-rider. So nurses just assume, okay, it's a secondary. It's just, it's a rider to whatever the maintenance fluid is. It's not, okay? You will hurt your patients. You don't wanna hurt them. You want them to trust you whenever you're giving them medications. So try to make the experience for them as comfortable as possible, okay? It's not to say that this still might not burn, because it doesn't have the lidocaine, but it should preserve the IV, make it last longer if you do it this way. Okay, some people's veins are just sensitive. And you guys can actually see if you run it with the secondary, you'll actually start to see the vein itself turn red. And so it's like it's infiltrating because it's just so caustic. So just be mindful of that, okay? And if you see it being done incorrectly, again, we're not trying to like over stuff. Just go tell your clinical instructor so then hopefully we can re-educate. Any questions?
If the potassium is infused with lidocaine, is still the same
Then you
process?
don't have to do this.
Okay.
If it's infused with lidocaine, great question. You don't have to have your maintenance fluid or anything like that, because it's already going to numb that vein so that it doesn't hurt. So you just run it at whatever rate your doctor puts it.
And it's already mixed together?
Uh-huh, pharmacy will mix it.
Okay.
It's not something that you'll pull, from the Pyxis, the Med Pyxis. Pharmacy will mix it for you, and then they'll send it to you for your patient.
And that's when you would pause the maintenance? Would you pause?
No,
the
your maintenance can still run.
It could still run, okay.
Mhm. As long as the fluid is compatible, with the potassium, you're fine, okay? So if I had amiodarone running into one IV, I could not come and hang up potassium. You know what I'm saying? I'd have to start a whole nother IV.
They could still get both, but that would need its
They just
own
need its own IV.
different IV.
Uh-huh.
Okay.
Does that make sense to you guys?
Yeah.
Cause there's gonna be a lot of times that you have medications that are running that you're not gonna be able to stop and administer other medications, okay? Critical care meds are one of those meds that, like, if I'm giving you Levophed to keep your blood pressure up, I can't just stop that. Like, hey, you need some Protonics right now. No, I'm gonna kill you because I'm gonna drop your blood pressure, right? So you guys just need to learn what is Y-siding, what meds are compatible, and like how you would go about administrating those. And ATI provides you with with that information. So just make sure that you study up on it, it makes sense to you. And then if you still have questions, obviously we're here, your clinical instructors are there, but just make sure that you guys have a really good understanding of how we administer medications, because that's what we do as nurses. That's like pretty much our whole job, is administering medications and assessing for the effects of those medications. Okay. Trach,
Drake.
what are your guys' questions on trach?